Welcome to MedAxiom HeartTalk, where thought leaders come together for one ultimate goal: to continually transform cardiovascular care for all. MedAxiom HeartTalk starts now.
Welcome to MedAxiom HeartTalk. Joining us today, we have Ana Mercurio-Pinto, Vice President of Care Transformation Services here at MedAxiom, and also Nicole Lohr, who holds several leadership positions at Cardiovascular Institute, University of Alabama at Birmingham. And we are talking about something that I know everyone will be able to relate to: closing generational gaps, leading change, alleviating burnout, and strengthening CV care. So thank you, ladies, for joining me today.
My pleasure.
You know, I think about the sandwich generation, and I'm in it, right? I'm raising kids. I also have an 82-year-old mom that I have to take care of and make sure she's okay. But that also translates into healthcare as well.
And we're seeing more and more of this. We have a true healthcare workforce crisis. Actually, I don't even want to say crisis. I want to say reality.
Right.
So we're at a point where we thought, oh, through COVID, some of the loss of healthcare workers will kind of transition back, but what we're really seeing is that the generational change, in our institutions.
Anna, talk about that, because you kind of are looking at this from like a data perspective, and it really is something we're seeing all over the country.
There really aren't enough cardiologists in training to make up for the amount of cardiologists we anticipate losing, right? That being said, it's still a different generation, right? For the most part, there are children, right, that are now becoming professionals, and you try working with your children, right? So we have this younger crowd coming in, becoming actively engaged in a practice. You have your very senior physicians who, for the most part, built these practices. They taught the clinical leadership to be doctors, right? So they're very respectful. However, they're also creatures of habit,
right?
And change is hard for them. So you have now, you make up this, sandwich generation of clinical leaders that are forced to figure out how to lead all these different generations and bring them together, right? They all communicate very differently. Do you agree?
I was going to say, Nicole, you kind of chime in there, because you've had to create some systems and have some play that kind of can relate to both of those groups.
Right. So, I'm a Gen Xer, right? So I was trained by Med. Yeah.
Me too.
Right. Where it was follow along, we're going to show you, do one, teach one, and that's it.
Right.
And so what we created was a system where leadership is based on individual value and not institutional value or group value. And that really kind of clashes with the generation that's coming, and I see it in the trainees and the early career faculty that say, hey, no, we're one unit, and this unit has values. And sometimes that's not aligned.
Yeah. How do you bridge that gap? What are some of the things that you're doing?
So a couple of things. One is in order to make the early career and trainees feel more part of the system, and again, leadership needs to look different. We're doing more work groups. So if you're in a practice, we're doing a work group so that all layers of the system, whether they be senior people who can contribute by experience versus younger or early career physicians who are bringing in innovation.
Right. It's different, earning their respect versus, you talk about Gen X. We were trying to earn the other generations, the older generation's respect. We were like, all the work, do it. And there's value in the younger generation too. They can teach us a lot as well.
Absolutely. It's, they add a lot of value. Our senior, very seasoned clinicians add a ton of value, right? But it's getting them to communicate. Part of it, though, is leading by example. Nicole's done an amazing job of leading by example. She works just as hard, and she does what she expects everybody else to do, right? And I think that's, has a lot to do with, with Nicole's success at University of Alabama that continues to thrive. Leaders have to engage, right? They have to be willing to ask, and, and again, this younger generation, they're incredibly talented in different ways, right? And we actually need to utilize those skills because of the changing landscape of healthcare with innovation, with AI. We need these younger folks who are so quick. 25% of our cardiologists are over 61, right? So they're aging out, right? At the same time, they're not retiring.
Right.
So they're still going to be part of our practice, and we need them because we don't have enough doctors. So we really need them, but we need to figure out how best to utilize their skills, how best to utilize the incoming folks. in order to grow and strategize together, right? Yeah.
And that's where I think being authentic to everyone has been what I strive to be as a leader. So I see a senior physician who honestly is the person I'm going to go to ask, hey, give me your thoughts on this patient. They also have a little bit more time and perspective to be able to impart some of that onto the other groups. So as we've started to build multidisciplinary mentoring teams for some of our faculty, even into the mid-career, because I think you can benefit from mentorship throughout your career spectrum, relying on their skills from the senior leaders to say, hey, this is how you get something accomplished can be incredibly valuable.
What's an example or like a strategy or technique that you really feel like successfully allowed you to kind of bridge that generational gap or close it?
Leadership has changed. And so I just always tried to think about when I was an early career faculty, what did I really desire out of the leaders? And so being present allows me to see what it's like in the trenches.
Right.
I'm not sitting and hearing intel, that's been filtered on multiple levels, right? I'm actually there and I'm listening to them, and then creating opportunities for all people within our division and our practice to have a voice. And so, your voice and input matters. It doesn't mean we're going to do everything you want or you think, but it allows you to at least understand where we're coming from. Right. And so I try to make ultimately I'm the decision maker, but that decision is oftentimes a collective process.
And people feel valued and they feel like they have some buy-in because they know that you'll be watching and listening.
Yes.
All right, so can we kind of turn to burnout? Everyone's doing so much. We look at technology, AI, it's making things easier, but there's a learning curve there as well. So what are you doing or what are you seeing that's helping maybe with burnout?
So for me, it's, again, going into the practice. So we know from surveys that we've done through ACC that non-clinical work is really a driver of burnout. There isn't a physician that I have ever encountered that said, I won't take on another patient.
Right.
But, right, there's always a but that comes after, and the but is the phone messages, all the other non-patient facing work. And so my job as a leader and an administrator is to reduce that. And that, to me, it can reduce the primary driver. So one of the things that we've done is instituting AI-mediated scribing, trying to organize our clinical footprint on the ambulatory side to build care teams that can kind of, again, everyone shares in the work.
Right.
Burnout is real. Bandwidth, the lack of bandwidth is real, right? And there's no solution coming anytime soon because we know there's not enough nurses, sonographers, doctors, right? That being said, it's change management, right? It's being innovative, utilizing our folks that are starting to slow down in different ways, capturing the energy of new career cardiologists, right? Those are my favorite, the ones that go from faculty, from fellowship to faculty because they're super energetic and excited and eager. So how to use that energy appropriately and ensure that they have all the right tools to start off to a good start, because if they, start off on the wrong foot, it sets everybody up to fail, right? So it's trying to capture the energy and the skill set of everybody to create bandwidth and to offset some of this burden, right? And hopefully, we're hopeful AI is a lot of the solution, right? Takes off a lot of this non-clinical effort. That's hopefully what's going to complement all of these problems, right, and help create that bandwidth.
You mentioned a couple of things that I think are really important. The first is starting people off feeling like they're embraced and valued and they belong in the environment is incredibly important. And so one of the things that I've really tried to focus on with our leaders within cardiology is to, one, set up a good onboarding process. Even attributing faculty to be like that buddy to kind of, I didn't know how to write a prescription, evidently, at UAB for months. I kept hitting the thing, and I thought it was working, right? Right? But, so it's those little day-to-day tasks that really can drive on you. And so it's kind of streamlining those process. And I think, again, for new recruits, at any phase of their career, but particularly younger, you know, again, the sandwich generation, it was like, all right, today's your first day, go.
Right,
Yeah.
survival of the fittest, right?
Yeah, it's
That's not the norm anymore. So that's the first thing I think is important. I think the second thing is, and I'm an academic institution, but I think it can be really applied universally, is that at some point you're either in your career because it's your passion, or if it's not, it becomes very transactional. And so for me, it's really listening to the faculty, understanding where their passion lies, which you kind of touched on as well, and how can I organize programs to support that, so that early career faculty, you know, after a year, I mean, there's a statistic, and I'm going to mess it up, but 40% of first-year physicians are looking for a new place after their first year.
That's shocking.
It's like a really
shocking.
insanely high
it
number.
takes more time than that to even get
Right,
settled.
and it costs us in recruitment, in lost revenue, all of this. So it's better for us to come prepared with a strategy to make people, one, feel belonged, and two, really feel like we're investing in them. You know,
Trying to figure out how to make everyone happy, and everyone's it doesn't always look the same, right? We mentioned recruitment a little bit. These doctors, they can go anywhere, really. I mean, they have lots of options. So how do you make sure they understand the environment they're walking in, you know, that it's thoughtful, and that you're having these kind of conversations to make sure they're part of it, and that you're utilizing everyone in a way that they may really connect with and want to stay?
I think good recruitment is your fellows. And so if your fellows buy into the culture, you know, again, I'm speaking from academics. So again, I have the luxury of kind of showing what the culture is to them. I think for those who interview, you know, and are in non-fellowship, you know, practices, I would say it's really excellent communication and very transparent communication. And that's one word we didn't use in this, but it's incredibly important. Transparency is key. And I don't care what generation you are, we all seek transparency. It actually helps with burnout too. And so being transparent, being organized, and I'd rather over communicate than under communicate, because this, you know, our nature is, hey, if they're not telling me something, they're probably hiding
something. Yeah, definitely. All right.
Yeah, you know, just to add to that, I think something that historically we haven't spoken about is the mental health of not only our faculty, but of our physician leaders, right? There's a lot coming at everybody. And I'm hoping it's something actually MedAxiom can start to build on, is how do you give the tools to our clinical leaders to be able to manage this diverse staff, to understand when they're in need? Because again, some of them don't verbally come out and say, I'm having an issue, right? You learn the hard way, right? But I think that's part of this new generation of leaders, right? Is now it's not just the productivity, but it's also how do you take care of the mental health of the people around you, right? And I think, you know, when people are happy and the culture reflects that, people see that and want to be part of it. And guess what? You may not be making as much money as the guy down the street, but it's all the intangibles within your practice, which is why you stay, right? And I think that's, you know, what we need to demonstrate, we need to model, and we need to tell people that, you know, we're more touchy-feely now.
Yes. We are,
absolutely are.
Than we
are.
were taught to be, right? Because we understand and we respect the younger folks coming in, and they value that, right? And we're learning to value it too. But we all need to learn together how to do that. Because historically, again, we haven't talked about it, right?
Right. Great information to share. Thank you, Ana and Nicole, for talking with us on this MedAxiom Heart Talk.